our special guest this evening is Pat Smith, the Lyme Disease Association president, and she serves on the East Coast. You all probably read about her in the bio that we had published. Pat is our voice and represents the Lyme community well. As you've read from the bios, she has many, many years of serving in this capacity. She is a wealth of knowledge and knows our pain. We are grateful for her leadership throughout the nation and very honored that she's willing to speak to us tonight here in Kansas City. And if anyone gets us, she does. So Pat, thank you so much for coming, and the floor is yours.
Thank you very much. Could someone put up my slides, please? While that's happening, I just want to thank the Congresswoman for all her work and support on Lyme disease. I know that across the country, we certainly appreciate that very much. And I know you work very closely with Congressman Smith. He said wonderful things about you. And I thank you very much. Okay, could we move next slide, please? Now, I've been asked to talk about a few different things. Just briefly, I just want to say that we're a national nonprofit and we raise monies for research, education, prevention, and patient support. And 95% of our monies go directly to our programs. We've awarded 121 research grants to date. And our literature, our research has been published in 54 journal publications, which is pretty significant to the Lyme movement. And we also help to endow the Columbia Lyme and Tick-Borne Diseases Research Center, talking about the one in New York. We've awarded educational grants to organizations and also scholarships for not only for physicians, but also for advocates to attend we have CME conferences annually for physicians to get credits. And we like our advocates to be able to attend, and also physicians at certain stages who can't really afford to attend, and we give them scholarships to be able to attend. We have a Lyme Aid for Kids program. It's available throughout the country, and we've given $400,000 to date in that program. Also, we partner with the Environmental Protection Agency to try to get rid of ticks, big problem, as you know. And we have more than 40 organizations that work with us under what we call the LDA Net umbrella. And I have twice testified before Congress at the Global Health and Human Rights Subcommittee of the House Foreign Affairs Relation Committee, and also in the Health Subcommittee of the House Energy and Commerce Committee. And I've helped to write and pass many pieces of state and also federal legislation. And in 2019, I briefed the Senate Aging Committee and also House members and staff. And on that note, let's move along to the next slide, please. Now, I've been asked to tell a little bit about my story since it involves my family and how I got involved, and also why I'm so concerned about our children. And I'm going to tell that first, and then I'm going to go into some of the statistics about what's happened in our schools with Lyme disease, and also about some of the issues that I think are important to your region and why you're having such a grave difficulty getting diagnosed and treated. So basically in 1984, I was a Board of Education member in my school district, and our teachers and students had a disease. Nobody knew what it was. And at that time, people were saying, oh my gosh, this disease is in their brain. So no guidance was provided from anywhere for our district. No health department came in, CDC, nobody. So I told the superintendent we needed to provide information for parents. And so that's how really it all began. I went into him and said, we need to provide information on parents. We have teachers in the hospital. We have kids that are really sick with this. And he said, well, what is it? And I said, Lyme disease. And he said, what's that? And I said, I don't have a clue. And he said, well, if you can find me information, we'll put it out. And so it was very difficult in 1984 to find anything about Lyme disease. I finally found it at the naval base, which is very close by. We got it and we disseminated it into the school district. And that's really when I began advocating for students in New Jersey schools, because I saw how many kids were really affected. And 2 of my 3 children developed Lyme in the late 80s. And it was fortunate because I had to be the one to, if you in quotes, diagnose them, because doctors were not doing that. And it was extremely difficult. So at that time, I started a group of patients in New Jersey that was for a really political action here. And then I also worked alongside a local group that became a state group. And then I joined that group and became president. And that's when we developed a nationwide focus and we became Lyme Disease Association, Inc. And I want to say, for those of you who haven't been around quite this long, that between the late 1980s and the early 1990s, that is when problems began to develop. And we saw that the peer-reviewed literature being put out by the researchers was suddenly stopping going in the direction that Lyme might be chronic and starting to say, no, that isn't happening. And that's when our doctors started to be across the country, and mostly in the East at that time, but they started to be attacked by medical boards for treating long-term for Lyme disease. And that was the, kind of the tipping point, and it probably puts many of you where you are today. Next slide, please. So in 1992, I approached my congressman, Christopher Smith, at a town hall meeting. And I said, I desperately need your help. I said, you have to do something about this problem that's affecting us terribly in the state of New Jersey. And I explained some of the issues with the schools, etc. So he said, well, what is it? And I said, Lyme disease. And he said, oh. So he said, could you tell me more about it? And he likes to tell the story that if you know Pat Smith, you know that 30 years later, she's still telling me what Lyme disease is. But basically, it was a great thing, because that started a lot of action in Washington. Immediately, within a couple of weeks of that meeting, he set up a meeting with me with the Centers for Disease Control and the National Institutes of Health in DC. And I prepared a report on 9 school districts in New Jersey that were being devastated by this disease, both staff members and students. And so when I went down and I presented this, the officials there were actually shocked at the levels of illness in the districts and the cost to the districts. In my district alone, our costs for home instruction due to the students out went up 88% in 1 year. I also presented them with data from 10 families on the amount of money they were spending for Lyme disease. And the officials were shocked, and they found it hard to believe. And I knew, and I'm sure the Congresswoman will appreciate this, that I had to do something to make an emotional tie to them so that they could understand. Again, this was 1992, and no one anywhere was taking this disease seriously. So here's what I did. First, I told them about my youngest daughter, and I said that she had been well, she was a gifted student. She played soccer. She played traveling soccer, all over. We traveled with games and so on and so forth. She played an instrument in the band. And then suddenly my daughter got this disease that just completely devastated her. She couldn't even leave the house, and she started having seizures. After this time, by the way, there was a period for 3 years where she seized for 3 years straight, about 15 to 18 hours a day, 6 out of 7 days of the week. And you know what? My doctors told me then, you can't tell anybody about this. I said, what do you mean we can't tell anybody about this? because what will happen is they will not believe you or your daughter, and she will not get treated for her disease, and she will be put in a psychiatric facility. And at the time I said, what? And even though the years I had been involved and I knew there were issues, but I did not think that that was true. Actually, it was 100% true, as I found out later from people who had that happen. So here I was, a mom, and I had to deal with this. So now back to my Washington, D.C. story. I told them about my daughter and how, everything. And I said, now I'd like to introduce you to my daughter. And from underneath the table, I pulled a briefcase out, and no one knew I was doing this. And I opened it up and I poured this on the table. And in the briefcase was vials and boxes and bottles of all the pills and things that my daughter was on for Lyme disease. And I had written on each one how much of each thing she took every day. And I have to tell you, later my congressman said to me, well, you sure know how to stop a meeting, because they got up from the table, they went through it, the CDC and the NIH, and they asked me, what is this for? What is that for? And they were totally astounded. So I went home, and then what happened is about a week later, I got a call from the state of New Jersey health department, and they said, is this Pat Smith? And I said, yes. And they said, well, who are you? I said, well, what do you mean? Who am I? I just told you I'm Pat Smith. And I said, who are you? And they said, well, we're thus and thus from the health department of New Jersey. And they said, well, who do you work for? I said, excuse me, what do you mean? Who do I work for? I don't work for anyone. I said, and they said, well, are you the person that was down in DC and presented about Lyme disease to the CDC and the NIH? I said, yes. And they said, well, you must work for someone. You presented a report. And I said, actually, no, I work for myself. And I said, I work for Lyme patients. And I said, I'm trying to have something done because our schools are devastated with this disease and nobody is helping. And I said, they need help and they need some kind of information and they need monies. And so I said, why are you asking me these questions? Well, the CDC has decided to come to New Jersey and do a study. I was like, okay. So the bottom line was, I said, well, I'll be happy to help you, anything that I can do. So the CDC came to New Jersey. I worked with them. They picked 5 of the 9 school districts that I had chosen, because I don't think they believed what I said. I don't know. But anyway, basically what happened is they produced a study. And of the 64 students studied, the CDC found that the median duration of Lyme was 363 days. The mean number of school days missed due to the illness was 103. The median duration of home instruction was 98 days. 1/3 and more of the families of affected children had 3 or more members at some time diagnosed with Lyme disease, including 40% of the mothers. 78% of parents stated their children experienced a fall in grade point average during the time of illness, and 79% experienced a decrease of friends. So there was a quote in the study which I felt summed it all up. And remember, this is from the CDC. Perhaps the greatest costs incurred by the studied children were the social costs of the illness and its treatment. Schooling and extracurricular learning activities were seriously interrupted for most children. Often, children spent large blocks of time as semi-invalids, isolated from social groups, and missing out on cultural, sports, and social activities. School performance of nearly all children fell, sometimes drastically, and in several instances was said to interfere with selections by colleges and universities. Now, the sad part of all of this was a wonderful study, and the CDC never published it formally. They came to my town with Congressman Smith set up a meeting. We had a full house. The CDC was there. I spoke, my daughter spoke. We had doctors who were treating Lyme speaking, and the CDC presented the results of the study. I had copies of the study they sent me, but at 15 years, every time I saw them, I go, when are you going to publish? Oh yeah, we're going to publish. Well, about 15 years later, they still hadn't. So what I decided to do is I approached the Lyme Times, you may know, published by our California affiliate, LDO, and they took and published the study. Since it was already presented, it could be published. So we did that. Next slide, please. So basically what I found in the schools, and I'm sad to say that there's still a lot of this today, it's lesser than it was, but what I found, the schools did not understand the disease. They weren't willing or able to put together what's called, and some of you know this as parents, IEPs for students who have disabilities, or 504 plans, which is federal, and they could be put under either plan. And some reasons for this were that the government and the medical establishment denied the effects of the disease, which they said was hard to catch and easy to cure. Now, mind you, I'm going back many years now, and I'm sure that you've heard the same thing now, that has still been said up until recent times. And the schools would mischaracterize the students as having ADD, ADHD, or other illnesses. They did not understand at all the neurologic aspects of the disease. And the schools felt that the behavior of some of the children with Lyme couldn't possibly be attributable to the disease, such as aggressive behavior. Those of you who know about Lyme understand that sometime in various stages, people can develop aggressive behavior, and it happens quite a bit to teenagers, particularly teenage males sometimes will have that happen. Now, they also didn't understand that IQ can actually drop with Lyme, and that was shown in a study later on, not that much later on, in 1998, from Columbia University, that there was a student who got a 22-point improvement on his IQ after he got IV treatment for Lyme disease. So the schools felt that the kids were faking when they forgot their assignments or books, were faking when they stayed home and said they were sick. They could not, how could they possibly be sick 1 minute and better the next, which we all know happens to Lyme patients? And if they were sick, they wouldn't allow them to take AP courses. For those of you that don't know what that is, in high school, advanced placement courses. Now, a lot of students who are at a high level take those, and that prepares them better for when they go off to college in some particular fields. I had a student that I was advocating for. He had Lyme disease. He probably literally had a genius IQ, and the district refused to allow him to take AP courses. So I went in as an advocate, and I said, what are you thinking? This child, this high school student, he was a young man by then, he's brilliant. Well, we can't let him take AP courses. After all, he's out of school. And I said, so what? The school, you're required to provide home instruction. Oh, well, we can't do home instruction for AP. Well, what do you mean you can't do home instruction for AP? Well, because we don't have anybody certified to teach AP courses for home instruction. I said, I'm very sorry, but since when did the state of New Jersey require a special certification for teachers who teach AP classes? Well, folks, I had them there, and to make a long story short, I want you to know that young man got his AP courses. Not only did he get them, I understand that he ended up in his home teaching the teachers that were teaching him. And he went off to go to, I think, Dartmouth. Very brilliant young man. But the point is, the schools don't have an understanding of these issues. And so the bottom line is, Even the Honor Society, they would not allow students in. My own daughter, who was out 4 full years, 2 partial years, went on to graduate, by the way, Phi Beta Kappa and with honors from Johns Hopkins. The Honor Society wouldn't admit her because she had no extracurricular activities. Well, how could you have extracurricular activities when you are not going to school? It's an impossibility. She was disabled. So these are the reasons why, and I'm going to touch upon a few things, but that we have tried to do a lot, and I have some ideas this year, and I may be talking to Congresswoman Hartzler in addition to my own congressman about this issue, of what we might be able to do to change that for our children. And so basically, I went to court several times with students, and I did all this for free to help them because they had nobody that was advocating for them and providing them with an education. And I will just say one more example. I was able to get a child who the district made this kid take the same courses every year for 3 years, because he'd start the school year, he'd be able to go partway through, and then he would have to go back home, and he was so sick. And on home instruction, they never offered him over the summer instruction or anything else. So he had to take the same course. And then at the end of 3 years, they said, well, now you can't graduate. I said, what do you mean he can't graduate? He passed the state tests, and you are the ones that messed up. Well, I'm not going to get into the details, but the bottom line is not only did he graduate, but the district, I got the district to agree, they paid for 2 years of community college for him. And so this is what can be done for our children. But it's a difficult task because we all know this disease is difficult to understand. So we provided a brochure called The ABCs of Lyme Disease for parents and educators. You can find it on our website, and the Lyme Association has gotten our brochures and put them in their packages for the schools out there, which we're very happy about. We also have Lyme Disease is No Fun, Let's Get Well, a book for kids who have chronic Lyme disease. And New Jersey has a state adopted curriculum and laws. And so we've tried to make this better for kids. And we have on our website a whole section dealing with nothing but children. Next. So what % of children in the US have Lyme disease? The LDA has a graph. It's on our website, and we try to update it periodically. And currently, 29% of children ages 0 to 19 make up our Lyme disease population, if you will, in this country. Next. So Lyme disease by the numbers. Between 2005 to 2010, the CDC estimate said, and I'm sure most of you remember this, about approximately 300,000 a year of people get Lyme disease. Now that was based in part on insurance claims. So from 2010 to 2018, the current estimate, also based on insurance records, is about 476,000 a year diagnosed and treated for Lyme disease. And so basically, they said in this report that states that that this is likely an overestimate because patients are sometimes treated presumptively. So what they were saying is, well, the physicians presume they had Lyme disease, so they probably didn't really have it. But they did say in this report that it's a very large burden on our healthcare system, the need for more effective prevention, and concluded that 59% of an increase in estimated number of people diagnosed and treated for Lyme annually over this time period. So we created that graph to show that difference. But the CDC website does state, it's important to emphasize 476,000 is the estimated number of people treated. for Lyme, and likely include some patients who were not actually infected. So we go back to the same old, same old. Here's the numbers, folks, but you know, probably a lot of these people didn't have it. Next. So the reported case numbers is important to know about because it's something that's used against us oftentimes. So in 1991, Lyme disease was made national notifiable. And so then a list is produced of the comprehensive reporting of diseases that occur in the US. And it's compiled through state health departments and the CDC working together. So the reporting of disease is mandated by state legislation and regulations. That means different states may have different diseases that they actually report to the CDC. Okay, now the case definitions, and you may have heard of this, I'm sure many of you did, CDC case definitions. They're created by something called the CSTE, the Council of State and Territorial Epidemiologists. They're not really created by the CDC, but everyone calls them the CDC guidelines. So these are updated periodically, and they were updated in 1995, 96, 2008, 2011, and 2017. 2017 is now the one that we are under. This is what everybody works under. So every time that these definitions were changed, they were made more stringent, folks. And the advocates felt very strongly about this. We looked at it, we objected to these changes. Every time the field of symptoms like this that you could, or whatever, to fit into, to become this, became smaller and smaller. So lesser and lesser people could be diagnosed from these definitions. And this is really problematic. And I don't think that most of us advocates have changed our mind on this. So even though the CDC does say on its website, surveillance case definitions, uniform criteria for disease reporting, and should not be used as the sole criteria for establishing clinical diagnoses, determining the standard of care necessary for a particular patient, setting guidelines for quality assurance, or providing standards for reimbursement. But I'm sure that all of you know and recognize that's exactly what's happening. These CDC, in quotes, guidelines are being used to prevent diagnosis, prevent treatment. They're used to set the IDSA guidelines to a large degree, and determining standards of care certainly for patients. So now the CDC used to report out the Lyme numbers weekly for many, many years. Then about 4 or 5 years ago, they started only doing it annually. And now, well, guess what? The last numbers officially that we have on Lyme disease from the CDC are from 2018. Now, the last I heard is that they were the 2019 ones, now that we're in 2021, should be coming out soon, whatever that means. So what do these numbers show? Well, in 2018, it showed that the CDC said 33,666 cases were reported. And everyone knew that these were, that 10 times more needed to be put into that to see actually how many cases occurred. So that was 336,660 cases for 2018 across the United States. Now, from 1990 to 2018, the reported cases were 681,357. And if there were 10 times more, that actually meant that there were 6.8 million cases that occurred over that time. That's a heck of a lot of disease, folks. Next. So the LDA has prepared maps, and we have them on our website. They're free for everyone to download and use. And they do show the total number of cases, in this case from 1990 to 2018. We also have individual years of maps, so you can look on there. And what's good about our maps, you can actually click on your state and next map, and I'll show you what can happen. Oh, sorry, it'll be the next map. So we'll do this first. This map, this pie graph rather, I'm sorry, that the LDA has done shows you what states have what percent of Lyme across the country. And I think this is a lot easier to see than some of the ways that it's been portrayed. So for example, this shows you for 2018, Pennsylvania had 30%, New Jersey had almost 12%, New York had about 9%, and so on and so forth down the line. And then you get to the last one, which is the remaining states plus DC. And that's where your states currently fit. Do they belong there? I can't say that they do, but that's where they fit according to reported cases. So that is 6% of the pie. Next, please. Okay, so this map shows, for example, Kansas. If you click on our LDA map online, you will pull up Kansas, and then you'll see that little chart going down from 2018 to 1990 each year, and how many reported cases that your state had. Next. This is a vector-borne diseases profile from the CDC on Kansas, and it shows a pie chart there also as to how much mosquito-borne disease compared to tick-borne disease. And you see, if you see the orange, you can see that the percentage of tick-borne disease is much higher than the percentage of mosquito-borne disease. And if you look at the bar graph, you see the orange, and you can see that's the same data, how much that is over the years. And I'm making a point because in our country, vector-borne diseases, mostly mosquito-borne, are given much more money than Lyme disease. Lyme disease is not given a lot of money, folks. I can tell you this. Okay, next. All right, this is Missouri. And you can see that in 2018, they had 1,313 cases. I'm sorry, from 1990 to 2018, 1,313 cases during that time period that were reported cases. And you can see the different numbers over the years on the chart on the left. Now, what also on our map, there's you'll see little triangles and other kinds of shapes maybe next to certain states. Now, what we do, because a lot of people don't know it, and this influences the numbers of cases, not only in your states, but in cases across the country, because states have the right to change their reporting criteria. And when they do, a lot of times that influences how much disease is actually reported, and then how much disease goes into the big pot of across the US. Now, how much disease, and I'm sure you all understand this, is, determines how much money we're going to get. So if a state changes its reporting requirements and suddenly their numbers go down, well, numbers overall are going to go down, and they're not going to, Congress isn't going to look at us in the same way, because they're saying, well, the numbers are going down. And for example, Massachusetts used to be and should be one of the highest states in the country. They no longer have any reported cases to the Centers for Disease Control because they changed their reporting requirements. And because they did, the cases that they were able to report were so minimal And because of different things that the CDC requires for you to report a case, they couldn't even, their cases are really, they don't fall into the top states any longer. They no longer fall into the top 15 states, and they were always in the top 15 states, somewhere around number 4 or number 5, but they no longer have, you know, unfortunately, the numbers. In New York State, the same thing happened. They estimate a huge percent of their counties. And if you estimate your cases, those numbers can't be reported to the CDC. The CDC can't accept estimated numbers. So numbers we now see out of New York are about half their numbers. And they used to be number 1 in the country. Now they're number 2 behind Pennsylvania. Well, half their cases are not being reported. Okay, next. Now this again is the vector-borne diseases profile from Missouri, and you'll see the same thing, how much tick-borne disease, the orange there in the graphs, compared to the little bit of mosquito-borne disease. Yet if you look at the Missouri website, you will not see a lot about tick-borne diseases there. It's very, very frustrating. It has to be frustrating for you. The same in the state of Kansas. There isn't the level of seriousness taken by your states. And Missouri had information that was far outdated. I was pretty appalled by it, actually. Okay, next. Now, this is a map just recently produced by the CDC. Now this map, all of these colors except the white, show you where the ticks are in our country that carry Lyme disease. However, what the CDC also did, they made this map about, well, yeah, we know that there's all those ticks there, but how much disease is really there? How many, you know, how much disease organism? So what this map actually shows is not just the ticks, but it shows what, how much Borrelia burgdorferi is there. And so, or Borrelia mayonii, which is the other organism that causes Lyme. So if you see the purple and the green, and that you say, well, that's a lot of ticks, but the CDC is telling you, well, wait a minute, we don't have any records that there's really, those ticks are infected. So what happens? States, and particularly states like yours that are already not showing up, even in my opinion, the amount of disease that's there, you're even getting less coverage as to how much disease is there. So these maps can be very confusing if people don't look to see what they really say. Okay, next. So I call this ticks and politics, and that's in I'm honoring someone who came from the state of Missouri. Some of you may have known him, Dr. Ed Masters, and he did a tremendous amount of work on not just Lyme disease, but on star eye, which many of us always called Master's disease. But when the CDC decided that it really was there and a problem, they named it star eye, Southern Tick-Associated Rash Illness. And so Dr. Masters did a phenomenal amount of work on what the disease was, what were the differences in Lyme and star eye, and how it really needed to be investigated. Yet to this day, there's no organism that is known to be causing star eye. I personally, and many other people and researchers say, why? There's ample, should be ample monies out there that should be able to solve the problem today with the technology of what is in that tick that's making people sick. Anyway, that's part of the politics, in my opinion, because of course they're not really doing the research on that. So this, and the Congresswoman mentioned this early on, this is the House Lyme Caucus. And what that is, that's a group of Congress people who all are concerned about Lyme and tick-borne diseases. And my Congressman, Chris Smith, is the chair of the caucus, or generally co-chair. This year, they're just pulling the caucus back together. It gets reformed every Congress. So we have a new Congress. This is a new formation. This listing here were the Congress people that were on last year. It's my understanding they'll be rolled over into the new caucus. They'll have to get, Congressman Smith is looking for a new co-chair, and which he, he's in talks right now to get that, because Colin Peterson from Minnesota, who was the co-chair and very Lyme friendly, unfortunately, he lost in the last election. So you'll be hearing more about this caucus as soon as Congressman Smith gets everything, and I spoke with them today, they're working on it. Everything is in order. We'll be asking the Lyme Association and patients to try to help us get others into this caucus, because in my opinion, to have 35 or whatever people out of 435 to be looking and caring about Lyme disease is just not enough. It shows you what they really think about it. And believe me, there have been many of us, again, working a lot of years to bring them up to speed education-wise as to what's happening. But for whatever reason, they're very reluctant to put monies toward it. Okay, next. So every year we work with us and our Lyme partners with Congressman Smith and the caucus on a lot of Lyme and tick-borne diseases issues. And as the Congresswoman mentioned this morning, earlier, the appropriations, we work with language for appropriations. So what does that mean? So what that means is when Congress, when like the caucus will write in and say to the appropriate committees, we would like you to give X dollars for Lyme disease or whatever else and other tick-borne diseases. Okay, so we work with them not just for the dollars, folks. The dollars are very important, but what's happened in the past, and quite frankly is continuing to happen, we feel, is that the dollars are not being put where they should be put. Chronic disease is, I'm sure that most of you already either experience it or know about it, and that's why you're here tonight. But chronic disease is what we need to have addressed by Congress, because acute disease has already been studied. I'm not saying they should never study that again, but they have numerous, peer-reviewed journals on acute Lyme disease and other issues like that. We need something that's going to help our patients, you and your families. And this is so important. So what we do is we are careful to develop language to put in these reports that go to the committees that say, we want you not just to give X dollars, but we want X dollars to go for X, Y, and Z. And language with Congress people is very, very significant. So that's what we try to do. And we've been somewhat successful to get things in. And next. Now, the Congresswoman mentioned the program this morning, and I don't know that if she mentioned it by name, but this is what she was talking about: CDMRP, Congressionally Directed Medical Research Program. Now, there was a whole program that was developed in 1992, and what this program is for is really to address things that affect the military and their dependents. And so we wanted to try to get Lyme and tick-borne diseases into this program. Amazingly enough, it was not in there. We tried for quite a number of years. We worked with Congressman Smith and the caucus, and finally in 2016, for the first time, they included Lyme and tick-borne diseases into this CDMRP program. So what did this mean? So this meant that we could now have some monies that we could use to provide grants for out there with all the different institutions would apply, all the different universities that do this kind of research. And then this program would look at those grants and either approve or not. So the first year we were only able to get $5 million, but we were pretty happy with that because it had never even been in a program, and it's very difficult to get anything into that military program. We knew that. So then we were able, subsequent to that, working with Congressman Smith and the caucus, we were able to get $7 million into it. And I think the Congresswoman alluded to that this morning. And so we have 7 million, still not a lot of money, but it's still monies we didn't have before, and it's funded through the Department of Defense budget. So in 2016, the first year, I was appointed, I served 4 years on that panel. I was on what's called the programmatic panel, doing vision setting, and I don't want to get into that because it's kind of more administrative. But then we also we pre-screened applications that came in for the grants from all over the country. And then we reviewed those applications. And that's called programmatic review. So we reviewed, and then we made the final determinations on which grants, based on which ones met the qualifications that were given out. So that's called CDMRP. We're going to be doing the same thing this year, working with the caucus to try to get more funds directed there. Next. Now, I'm sure that some of you, or hopefully most of you, have heard about the Tick-Borne Disease Working Group in Washington. Now, this was strictly a patient-driven activity. Now, I worked for 20 years with Congressman Smith, a number of senators, and other congressmen over that time period, developing and putting in legislation. Every year we would put in legislation to form an advisory committee for Lyme and tick-borne diseases. Who would think that you would have thought we were asking for the moon to get this, because other diseases were getting monies, many dozens and dozens had advisory committees. We could get nothing because we were stonewalled. Again, Lyme disease is like, it's just all by itself. It's in a category by itself. No one wants to touch it. It's changing slightly, but not a whole lot yet, but it's getting better, folks. It is getting better. So anyway, what happened was in 2016, we were finally able to get a law passed. Actually, it was part of the 21st Century Cures Act. We took a law that we had already introduced, and we put that language into the 21st Century Cures Act, and that was a giant bill. So it passed through, and it formed something that was called the Tick-Borne Disease Working Group. And I had a hand in writing that legislation, also helping to negotiate it at the last hour, literally the last hour, and also to get it passed. So what was the purpose? Purpose of the working group was to provide expertise, review the activities within Health and Human Services on tick-borne diseases, ensure that the agencies were coordinating and that they wouldn't overlap with one another on research, and examine what were the priorities, the research priorities. So on this committee, we had put this in legislation. We had patients, advocates, physicians, researchers sitting at the same table as government entities. This is the first time, folks, that this happened. We didn't have this happen before. In the past, the decisions that were being made about your lives or your family's lives as Lyme patients were being made behind the scenes by all these government agencies. And even though we were out battling, seriously battling for decades, we could not get at the point where we could sit at the table when this would have to be public and transparent. So we were very happy to be able to get this. And one of the biggest points was that the members had to have diverse viewpoints. In fact, it's the point that almost killed the bill. 1 hour before, literally, that this bill had to go into the committee where it was going to be heard, I was on with pretty high up leadership office. And they said, no, we have to remove diverse viewpoints. And I said, well, after having been on for, I don't know, a day or two before Thanksgiving, I was on there. We had to do this, believe it or not. And the bottom line point was, I said, well, I looked at this and I said, our patients deserve better. They need to have people on there. We don't want the same people who have been making these decisions, which have been against our patients getting treatment for all these years. We need people on there that are going to have a diversity. So what happened is I said, I'm really sorry. I appreciate your help. And I said, but thank you very much. We don't want the bill. And I hung up. And I will tell you, it was 30 seconds or a minute later, they called me back and they said, you got it. And I said, well, I thought you just said we can't have it. Well, you can have it. And I knew what it was because I basically said, we'll come out across the country and we'll oppose this bill if you introduce it this way, because it'll do nothing but hurt our patients more. So we did get it. So basically there's 14 members that sit on this working group. 7 members are from the federal side, 7 are the non-federal. So in 2017, the first year, I was appointed as a public member, and I co-chaired on there the Disease Vectors Surveillance Prevention Subcommittee with Ben Beard from the CDC. And then in 2019, which was the second term, I was the only public working group member reappointed. None of the other 7 were reappointed. Don't ask me why. I can only tell you that's what happened. I co-chaired the Training, Education, Access to Care Reimbursement Subcommittee, which we always called the Patient Committee. That was the committee where all the action for the patients would take place. By the way, I do have to say, because it's required, I say that the views expressed here are mine and don't represent the views of the Tick-Borne Disease Working Group or Health and Human Services. Next. So what happened? So the working group was in effect for 6 years, from December of 2016, and it'll go through December of 2020. The law requires a report at the end of each of 2 years. So that's 3 reports in total. So the 2018 report to Congress was submitted in December of 2018. And this report was pretty balanced by viewpoint. And patients had 3 reps that time sitting on the panel. And we also had good panel leadership. And differing viewpoints were heard on the panel. And the report really had some great recommendations. We worked really hard on it. And Lyme disease itself was very well represented. And even the CDC and NIH did try to make some changes and concessions. Even after the report was put out, they were doing things on websites and things that seemed to be concessions. So now we have the Tick-Borne Disease Working Group of 2020. The report wasn't given to Congress until February of 2021, though we were done with the report in early December. And the working group really only had 1 patient rep. That was me. And the other 2 former patient reps from the working group 2016, their positions were replaced by researchers, particularly researchers in rickettsia, not even in Borrelia. So we also had, and some of you may know this, a very controversial IDSA doctor. And the patient groups nationwide tried unsuccessfully to remove this physician. And unfortunately, it didn't happen. The meetings were extremely heated. I don't know how many of you listened. You can actually still listen. It's still up on the website. They have the transcripts and they have, audio transcripts. And the working group tried to rewrite our patient access chapter, the one I mentioned that I co-chaired, 2 weeks before the end of the term, meaning we were ready to submit, we were going to submit a report to Congress that we had pretty much almost all done at that meeting. And several people there said, well, we want to rework this report. Well, like, what are you talking about? This was after months and months of me basically, and eventually I got a great co-chair from the federal side who helped in these negotiations. And so the point being is that I forced a vote. I made them vote because I knew it was the only way that we were going to have something happen here. Otherwise, they were going to rewrite our chapter. So the vote actually passed 8-6 to keep the chapter as written. So it showed that we had made some headway and we had gotten quite a number of the feds to go on our side, because some of the people on what I call our side, the public side, were not really on the side of the public. They were on some other side that did not want chronic Lyme. They were very clear about that, anything to do with chronic Lyme. So at the final meeting, I read a statement including the following. The question thus becomes, whose interest was this panel designed to serve? Those are the patients who for 2 decades fought to pass the enabling legislation for this panel to help focus on their plight, chronic Lyme disease, or for medical specialty society special interests. And that was basically how I closed my last meeting on the working group. So now the new working group for 2021 and 22, the last one, is being selected. So we were very concerned as advocates, and we led a coalition of groups. And what we did is we put together a letter, very detailed letter, expressing all our concerns about what happened at that working group and how they were marginalizing Lyme disease, and in particular, chronic Lyme disease. So we sent that to the working group, and I also worked with the Lyme caucus, and they sent in a letter to the working group with those concerns. So we're waiting, and any day there should be making an announcement of new members. And hopefully some of the steps that we tried to take to change what will happen in this new group is going to happen. Next. So this is a part that affects your states out there, not just Kansas and Missouri, but several other states in your region and also the far west. Now, some of you may know something about this, but I'm going to try to explain. It's very important because a lot of this is why you guys can't get diagnosed, you can't get treated, you can't find doctors. Comes down on what I'm going to tell you about. So I mentioned earlier about the Lyme disease 27 case definition. Remember, I said it was called this, everyone calls it the CDC definition for Lyme, but it really isn't. But anyway, it's supposed to be for surveillance. It's not supposed to be for doctors using it to diagnose. Okay, so in this definition, for a confirmed case, a case of EM, which you know is the rash, with exposure in it, has to have exposure in a high incidence state. Okay, that's number one, a case of EM with exposure in a high incidence state. If you have that, then you can be construed to have Lyme under this. Or if you have a case of EM with lab evidence of infection and known exposure in a low incidence state, That is you guys, a low incidence state. So now what happens, that puts the onus. You are a low incidence state, and you now have to have lab evidence to fit under this. Or any case with at least one late manifestation that has lab evidence. So how do we define this exposure? How do you have to be exposed? Well, this is insane, but this is the way they do it. Having been less than or equal to 30 days before the onset of a rash in wooded, brushy, or grassy areas, which are considered, these are potential habitats of Lyme disease vectors. Since infected ticks are not uniformly distributed, a detailed travel history to verify whether exposure occurred in a high incidence or a low incidence state is needed. So you guys have to have exposure in a high incidence state unless you have a test and unless you meet all these other requirements. Okay. So how do they categorize states as low incidence or high incidence? So a high incidence state is a state with an average Lyme disease incidence of at least 10 confirmed cases per each 100,000 of your population for the previous 3 years. A low incidence state is a state with a disease incidence of less than 10 confirmed cases over 100,000 of population over those 3 years. So what does that mean? Well, from 2016 to 2018, Missouri had 3 total cases reported. And reported cases don't just include confirmed, they include confirmed and other type of cases. And the same with Kansas, had 109 cases over that time period. Now the population of Missouri, and these numbers are approximate, over that time period was 6 million. So you have to figure how many 100,000s in 6 million. And for each of those 100,000s, you have to have 10 confirmed cases for each of the 3 years. Think about it, folks. And Kansas had a population of approximately 3 million over that time period. So advocacy groups, and LDA in particular has for many years tried hard to have the government change this, since it's being used to prevent diagnosis and treatment, especially in low incidence states. Next. So what happened? How did I try to influence this while I sat on the working group this last year? So here's what happened. The Access to Care Subcommittee, that's the one that I co-chaired, and I call it the Patient Committee because that's what it's really about. We unanimously recommended to the working group this following action: that CDC provide input to the CSTE, that the Lyme disease surveillance case definition be revised such that it abandons the use of geographic parameters for Lyme disease. So to boil it down, what that meant is all we asked was, CDC, would you please go to the CSTE and say that you really don't want to have this geographic parameter for Lyme disease in there? Just remove that, because it's really hurting patients and it's hurting treating physicians and physicians that would like to treat. Well, basically what happened is I presented this to the working group and they altered the above recommendation. And the agencies, CDC and NIH and FDA, didn't give any sustainable reason to me or the working group for not supporting this. They just said, no, that we're not going to do this. And I'm like, We're not asking you, to provide $100 million. We're asking you to remove one restrictor that would help so many patients across our country. And they would not do it. And they were quite adamant about it. Additionally, at that time, they decided to remove this altered, and I'm going to talk about this altered recommendation, out of our patient chapter and put it into the surveillance chapter. And I said, well, the only reason I could think you would want to do that is because you know that Congress, when they read this working group report, they're going to look at the chapter that affects the patients, the access to care chapter. They're going to look at some of the others too, but they're not going to give it the scrutiny as they would, because these patients, you are their constituents. So they removed it and put it in there. So what happened was, I'm not going to bother reading this recommendation, but it's a totally different one, not including that proviso whatsoever about asking for that removal. So what did I do? I voted no. Now, why did I do that? I did that because by virtue of me voting no, I could now put in a minority response inside this report to Congress. So I developed the following minority response, and it can be found in the working group report, which you can all find. And by the way, the links I have, a lot of them on here are clickable when you get the slide presentation eventually, or you can just put them in and find these things pretty easily. So next slide, please. I'm not reading this, but this is actually a copy of my minority response, the effects of geographic restrictions. And this is taken out of the Tick-Borne Disease Working Group report. And again, it's something that you can read. Next. But here are the things that I put into that report. That what happens is physicians are misled regarding the risks of Lyme disease in these low incidence states. And doctors who are practicing there discount the potential of Lyme disease. So what does this do? It delays diagnosis for patients, and it delays their treatment. And what do we have from that, folks? We have more chronic Lyme disease. And so having a state-based incident, which they have in this definition, what does that do? Well, it precludes a diagnosis even in a hot spot in a state. So what does that mean? Let's say, for example, the state of Missouri would have a particular area, I don't know, Cape Girardeau or someplace else, that where they have a lot of more Lyme cases than anywhere else in the state. Well, guess what? It wouldn't matter. Your chances of being diagnosed there are still going to be probably the same as everywhere else in Missouri, where maybe that is not as high. And I'm just using that as an example. I don't know where the high instances are, though I suspect there might be one of them. So that would be a hot spot. But because they say your whole state is low incidence, you don't have any recourse. And your doctors are going to look, well, I'm sorry, but our state's low incidence. We don't have Lyme here. I can't put myself on the line. And they may not be saying this, but many of them are afraid to diagnose and treat, because over the last 30 years, doctors across the country have been brought up on charges by medical boards for diagnosing and or treating Lyme disease or treating long-term Lyme disease. So what happens is you have less doctors to diagnose and less doctors to treat. And so, of course, as patients who are misdiagnosed or not even diagnosed, you have to travel to distant states for doctors. That costs you more money, more time lag, and also many of the doctors in other states are already overwhelmed with patients in their own states. So it's hard for you to get fitted in. Next. So that is why I'm so concerned about what is happening in your area of the country and has been happening. And I personally and many of our groups have fought this tremendously to try to get you the justice that you need there. So I went on at your state websites for ticks and tick-borne diseases in both states there. And so I went on in Kansas and Missouri, and first of all, the ticks were pretty much the same listed, the ticks they had, that they consider these ticks to be the most concerning in these two states. American dog tick, Lone Star tick, the black-legged, which is the deer tick, the brown dog tick, and the Gulf Coast tick. So those were pretty much in the same, they're in the same ballpark there. So then I looked at the diseases that were listed. So Kansas actually had a pretty nice graph on there for, I think it was 2016, I believe, to tick-borne disease confirmed and probable cases, which they said was, the number was 251 cases. And then they gave spotted fever rickettsiosis as 52% of those cases, ehrlichiosis 21%, tularemia 10%, anaplasmosis 2%, Lyme disease 15%, and lo and behold, they didn't even have star eye listed, or Master's disease. It wasn't even listed there. I said, I know that there's star eye / Master's disease in Kansas, but it was not listed. So then I went and I looked in Missouri. Now, Missouri had a little bit different. They listed Rocky Mountain spotted fever as their first one. And if you look back over at Kansas, you'll see it says spotted fever rickettsiosis. Well, what goes here? Well, it shows you that Missouri is kind of behind the times, because the CDC now, for the last several years, groups all of the diseases that they consider produce spotted fever of some kind, including Rocky Mountain, are all grouped together as spotted fever rickettsiosis. They don't necessarily separate them out, even though Rocky Mountain spotted fever is the highest number of those, I believe, is anyway. And it's certainly the most serious out of those diseases, especially if it's undiagnosed and untreated. But nonetheless, they don't even, Missouri doesn't even list it the way the CDC lists it. They could have broken out Rocky Mountain spotted fever, but they didn't even include the other spotted fever rickettsiosis. Then they also had the ehrlichiosis, the tularemia, and they had Heartland and Bourbon viruses. You may know about them or you may not, because there's not a whole lot of them, but they are there in your area and in other states in the Midwest. And then they listed Lyme / Lyme-like disease. Now, that hasn't been done, to my knowledge, for probably about 10 years. They used to list certain diseases like that. But Lyme doesn't even have its own separate spot on the Missouri. That's the way it was listed with the slash. And they don't list star eye and Master's disease. So I made my question there is that mean that the Lyme-like is star eye / Master's disease? I'm assuming it does. I don't know it, but I thought it was very sad for the late Dr. Masters, who was one of the greatest researchers in the country on star eye / Master's disease, that they didn't even have it listed on the website in Missouri. So it was kind of disappointing, and the websites were kind of disappointing. Next. So you might wonder why I'm going to talk a minute or two about this tick, and you may have heard about it or you may not have. There's a new tick in the United States that was first discovered in New Jersey, and we all know that there's many, I'm sure you've heard the many jokes about New Jersey, and some of them are valid, and I laugh. I actually am a native Pennsylvanian, so I can afford to laugh still about New Jersey. However, what's happened is this tick came in from Asia, and it's called the longhorn tick is the common name. It's actually a Haemophilus longicornis tick. So this map shows where this tick is. So it was found in New Jersey in 2017. Here it is, 2021. It's already in 15 states. And you can see that these ticks are approaching where you guys live. And the main portions of the Longicornis are as far west as eastern Tennessee, but there's also a little cluster there in Arkansas. So the real bad news about this tick is that it can reproduce parthenogenetically. So what does that mean? It does not need a male tick. The female does it all, folks. So one tick can come into your state and start a whole population of ticks. This is very dangerous. Now, this tick in Asia carried a bunch of different tick-borne diseases, was devastating to cattle, did bite humans and sometimes transmitted diseases to them. It's come over here, and the government is basically saying that so far they really haven't detected diseases in the Longicornis that are being transmitted to humans. I saw one study just recently out of Pennsylvania. I think one tick was found positive for, I believe, for Borrelia Longicornis, if I'm not mistaken. And I also saw a study where they introduced, I think, ehrlichiosis or something into it in the lab to see if it could indeed harbor this organism. But other than that, as far as I know, so far, it has bitten a few humans, I believe, but so far that we know about, I don't think it's transmitted anything. However, it has started devastating some of the cattle population, which is our beef, and there can be 1,000 ticks on one cow. And it's basically killed some cows already, and it's spreading throughout areas with, it was actually found in New Jersey on a sheep farm, was found on sheep, and then the owner got them on her, I believe, and she went to the health department. She had no idea what this tick was, and they came out and monitored her property over winter because they said, oh, this tick probably can't, survive over winter. Well, guess what? It survived. Not only did it survive, spread throughout New Jersey. It's in my county now, and I don't know offhand how many more counties here. But this report is telling you that this tick is on the move. I'm telling you only just to be aware of it, listen about it if it does come, and if in the meantime that it does become a threat disease-wise to humans, which we don't know if it will or it won't. Okay, next. Now, also not listed on either of the health department sites, but I understand from Judy Campbell that you do have cases of it out there. So I felt that I should put something up about this. If you're looking for some of the latest information, the 2020 report to Congress from the working group, which you can access either on our website or on the working group website, there was a whole section on alpha-gal. So basically, ZMaps, which is where I got this, seems to confirm that there are cases in your region. And this comes from the bite of a lone star tick, or at least that was the original thinking and seemed to be the most prevalent. But now I understand from my work with others on the working group that are studying this in Virginia, that other ticks may now also be responsible for passing on this alpha-gal meat allergy, which is an allergy to red meat. And also in a lot of cases, people become allergic to the products made from red meat, which can include cosmetics and medications and all kinds of other things that you might not even think about. Now, one of the alpha-gal organizations had written me and said that they had contacted, I think it was Pfizer, to find out if they had any kind of beef product in their COVID vaccine, and which they did not find anything online, but I believe that they were told that they did have cow's milk in that. I cannot confirm this, but I feel it's important enough to say, if you have alpha-gal, or you're allergic to some of these other kinds of products like that, that you should definitely check personally with the manufacturer to find out if the vaccine does indeed contain any of that kind of product. Next. So on that note, I understand that there was, I know there's a lot of interest everywhere in the country now with Lyme disease and the COVID vaccines. And so I included a couple of slides. I do want you to know that, again, I'm not a doctor, I'm not a researcher, just have a lot of experience working with with others to try to produce information that we can put out there and let you know where you can get this information to make decisions. The LDA does not currently have any position on any of the COVID vaccines at this point. And so the two COVID vaccines that actually are in use right at this very moment in the United States are what it's called mRNA, or messenger RNA vaccines. Okay, mRNA is the genetic material that contains instructions for making proteins. So this is a new type of a vaccine. It doesn't put any kind of a germ, no bacteria, no virus into your body, but what it puts into your body is something that teaches the cells how to make a protein that will trigger an immune response. And this protein is called the spike protein, and it's found on the surface of the COVID-19 virus. So what happens? That response that your body does to this hopefully produces antibodies that will protect us if we get the real virus. And it's given in the upper arm, and it goes into immune cells, which use the instructions then to make this protein. After the protein is made, and this is according to the manufacturers, of course, the cell breaks down and it gets rid of that mRNA after it's finished using the instructions. So what they're saying to you basically is that this material is gone after your body uses the instructions. So the cell displays the protein on its surface, and the immune system does mounts the response, or the antibodies. So the mRNA never enters the cell nucleus. Now, why is that important? Because there's been some discussion on the internet and various places as to whether this could affect your DNA. And your DNA is inside the cell nucleus, and so it never enters that where your genetic material is, or this is according to the manufacturer. I can't, vouch any of these things because I don't manufacture the material. So researchers have been working with mRNA vaccines for decades, but never have had one out before. So these two mRNA vaccines are being used under what's called the FDA Emergency Use Authorization. And that allows the FDA, under certain conditions, including pandemics, public health emergencies, to get rid of some of the processes, to speed things up so that they can put a vaccine out much more quickly. But they must, under this, determine that known and potential benefits outweighs the risks. Okay, next. So again, this information comes from CDC and the companies' websites. So there's two vaccines in the US, both are mRNA, the Moderna, and that's for those 18 years and older. You get 2 shots, and they're 28 days apart. According to the manufacturer, there's no eggs, preservatives, or latex. The duration of protection, they say on their site, is unknown. Now, Pfizer has one out, 2 shots, 21 days apart, no eggs, preservatives, or latex. I couldn't find on their site whether they said anything about the duration, so I don't know. They have issues with the storage only because it has to be extremely cold temperatures. So it's a little more difficult sometimes in the distribution system. They have to make sure these temperatures are maintained. Now, according to CDC, they have learned of reports that some people have experienced severe allergic reactions, also known as anaphylaxis, after getting a COVID-19 vaccine. And they claim that there's not that many of these. The CDC has also learned of reports that some people have experienced non-severe allergic reactions within 4 hours after getting vaccinated, such as hives, swelling, and wheezing. So what the CDC says, they recommend on their website, and again, I've put this site there for you to find, if you have had an immediate allergic reaction, even if it was not severe, to any ingredient in an mRNA COVID-19 vaccine, CDC recommends you should not get either of the currently available mRNA COVID-19 vaccines. Also, if you had an immediate allergic reaction after getting the first dose of an mRNA vaccine, you should not get the second dose. That's CDC telling you. And it says your doctor may refer you to a specialist in allergies and immunology to provide more care or advice. Next. So now the CDC has a list of conditions that they consider COVID-19 risks for people. Unfortunately, and many of us have been not happy about it, Lyme is not included on the list, but they do have various things about heart conditions and immunocompromised states and so on. And again, at the bottom of this slide somewhere, I believe is the website for this list. You can find it for yourself of what these things are that they tell people, that CDC tells people that these are risk factors for you if you're thinking of getting COVID. Next. Now, this actually happened yesterday, and late last night, I sent the group out this slide I prepared, I think at midnight, because I wanted you to be up to date. So this is what I call breaking news. Came out yesterday. I have not seen the actual FDA report because it wasn't even on their website yesterday when this came out, but I went through and found various media sources to provide this information, at least initially, so you would know what's happening, because this may be approved within the next couple of days. So this came out yesterday, February 24th, 2021. The FDA has indicated that Johnson & Johnson's COVID-19 vaccine has met the requirements for emergency use authorization. And you may remember that I mentioned to you the other 2 mRNA vaccines that are out there are already under that emergency use authorization. So now they said J&J has met that requirement. So a report was done from the staff, and they're going to use that report to brief the Vaccines and Related Biological Products Advisory Committee meeting, which is tomorrow, and they'll review Johnson & Johnson's application to get this emergency use authorization of this single-shot vaccine. Now, what I read from various media yesterday, again, I have to rely on sometimes media that's not real reliable, or sometimes it is. So I have a disclaimer at the bottom saying that some might have slightly different information. So this is currently what I knew at the printing of this yesterday. Okay, so the level of protection varied for this vaccine in different regions worldwide. Apparently was tested that way, with 72% effectiveness in the US, 66% overall at preventing moderate to severe COVID-19 20 days after vaccination. And that was according to a February 4th Johnson & Johnson report to the FDA. So a CNBC website said, quote, vaccine effectiveness was similar across age, race, and people with comorbidities, the FDA staff said. However, the effectiveness appeared to be lower in people who were 60 years or older who also had comorbidities, like diabetes or heart disease, the agency said. Adding the efficacy rate was 42.3% about a month after getting the shot. So the bottom line, if you're 60 and you have some kind of a comorbidity, something else that might affect this, maybe that the efficacy rate for this one is going to be less. That's what they're basically saying. So remember, this vaccine is not an mRNA vaccine. So what is the mechanism? It uses a weakened cold virus to carry the instructions into the body to trigger the immune response. So again, I say the LDA doesn't have a position on COVID-19. And also I want you to know that everything we presented throughout the slide presentation is for informational purposes only. No information should be considered medical or professional advice. We don't give that kind of advice. And all information should not be used to take the place of advice from your personal physician or any other professional. We don't endorse professionals, products, or services. Next slide. So at this point, I want to thank you for your attention. And I want to thank the Lyme Association and all advocates and patients and doctors and researchers for everything. And ask, I don't know if we have time for a few questions or not at this point.
This was a great presentation, Pat. Thank you so much. We've learned a lot. Leslie Martin and I are going to ask some questions, if you don't mind. We are at 8:30. Do you mind answering just a few questions?
Not at all. I'm at 9:30 and I could go to 1 or 2:30 my time. So feel free.
Oh my, okay. Leslie, do you want to start with a question?
I can start with some. Now, these are questions from the attendees that they have put into the chat. And
Right.
So we will read these and hopefully be able to interpret them as well as possible. But your first question is, how can we get accurate, consistent reporting positive test results to the local health departments, states, and CDC? For instance, this attendee tested positive for Rocky Mountain spotted fever, and her doctor said that she might get a call from the health department. She had hoped that she would, but it didn't happen. She was tested in a state that was different from the state in which she had the tick bite. So like everyone else, I have no confidence in any of the numbers that you were reporting.
Okay, good. I have none either. So anyway, okay. So that's very serious, of course, because Rocky Mountain spotted fever in itself is extremely serious. So I would want to know, I'm assuming that the doctor definitely indicated to the patient that they reported it to the state health department. So now what I would do first, if I were the patient, I would first in writing, email if you can. I don't know what doctors are accepting these days, or try to get it in writing. If not, confirm with the office that the doctor reported your case to the state. Now, if you don't hear anything else, and if they don't contact you, I would, meaning the state, if you hear that the doctor reported it, I would write to the state, and I would put out something that clearly stated I, was tested. I was positive for Rocky Mountain spotted fever. My doctor reported my case, and I would like to know if my case has been, put into the system in the state, I think you said Missouri, whichever state, for, Rocky Mountain spotted fever. But in writing, you must do that. You never, phone calls, it's okay to call them up and ask them, but, putting it in writing is a little more, forceful. Now, this is my opinion, and it's entirely up to what you think. But because of what I see in your states, it's so horrifying to me. And again, 37 years, folks, I've done this across the country. And so, and by the way, my first daughter was born in Kansas. We lived, my husband was in the Army. I lived in Manhattan. And so, I love it out there. And, it's a great area of the country. And I spent time out there talking with, I went to conferences in Missouri to speak on Lyme with Dr. Masters and others, and with the Lyme Association of Kansas City, went out there. And so, this is so far from wrong that I don't know how to emphasize that. So I personally would copy Congresswoman Hartzler on that. On the correspondence. I have made a habit over the years, and I've told people, this is how you can get some attention. For example, and I'll tell my little story, but when I sent the letter to the working group and we have 43 other groups signed on that letter, and I sent it to HHS saying, here's the problems with the working group in 2020, as I saw it, 2019 and 2020, and we listed all these. I had on there a list of, well, I don't remember exactly, but I'm going to say it was probably 35 or more congresspeople that I knew, either in the Senate or in the House, that were concerned about Lyme. And I made sure, and it's not easy these days getting in touch with them, but I made sure every one of them had a copy of that. I believe that makes a difference, and it was acknowledged to me by someone that they knew that all those people were copied on that letter. So I think it's very important. And since the Congresswoman is also very attentive and has worked very closely, I know, with Congressman Smith on this issue, I think it's important that she know. Now, if you're in Kansas, I would find either your congressperson or senator, find out who there maybe has been at least, somewhat supportive. I would copy them, and that's how I would proceed with that.
Wonderful. Okay, thank you for that. Okay, the next question. When Lyme was renamed StarEye, the numbers of cases dropped in Missouri. How can we combine StarEye and Lyme cases?
I think there's some confusion. Lyme was never renamed StarEye. What happened is one of the definitions that I mentioned, how they did them over so many years, I think it was 2008, but I wouldn't swear to it. When they changed that definition, they kind of excluded StarEye out of there by saying, before that time, if you had a rash and you were anywhere, at least in our country, you were supposed to be considered Lyme disease. But when they made that definition up, they excluded that. And that's when they started saying, well, they didn't use the term high incidence then, they used endemic. And they changed the definition. And so that meant that if you were star eye, you may now, nobody would really maybe know, because there's really no test for star eye, a definitive test. And, and they don't know what the organism is. And so a doctor may not diagnose you with that. And so that was problematic. So I don't know, I'm not sure that I'm clear on what that question actually meant. I can only say that it wasn't renamed that. Star eye has been Southern Tick Associated Rash Illness. It still is. And again, with unknown etiology. Nobody knows what the organism. They did say for several years, Borrelia lone star eye. In fact, we printed our material out with that on. And after a while, they said, no, that isn't it. And of course, it makes me wonder. But I will tell you that me and a couple of other people from the LDA went down that year to Atlantic City. The CSTE, who was changing the definition, was having their meeting there. And quite frankly, they tried to intimidate me. Dr. Cameron and I had gone down, and they tried to keep me from, they didn't like me speaking and saying that the LDA was opposed to this change in definition. But I'm not readily intimidated. I've learned a long time ago that if you're going to do the job that I'm trying to do, and that other people who are trying to do this, as much as you might like to, you can't let yourself be intimidated ever, folks, never. And take this from someone, I started as a mom of 3. I'm now a grandmother of 4. And all girls, by the way, daughters and granddaughters. But my point being is that you can't let them think that you don't know what you're talking about, that you haven't experienced what you've really experienced. You just have to pursue it, and you have to say, this is what happened to me. This is what happened to my family. And here's what I have, and hopefully you have material that can support that. And so that's why we all have to kind of, I don't know if I answered the question or not, I'm sorry. I got off the track a little bit, but I wanted people to understand, don't discount yourselves from having influence on this process. You all have influence, and you can work through Lyme Association of Kansas City, other Lyme organizations. You can work on your own. I started working on my own. I didn't have anyone. And I just said, what's happening? And so, but today you don't have to do that as much. There are people you can partner with. And so, and things are changing, folks. In your area of the country, it's changing a bit slower. But don't think that we, and I say us and LDO and other organizations, are not trying to change that picture so that we can get a map that actually shows, hey, these people are really serious. They have Lyme disease out there, and they need to get diagnosed and treated. I'm sorry if I didn't answer the question. Sorry, please repeat it if
Well, no, that's a wonderful answer and great advice. So, and if anyone has any further questions, please feel free to post them, or if someone wants clarification on something, feel free to put that in the chat as well.
I do have a question. This is Judy. Someone sent me a question to ask. This is one of our members, Pat. When someone has had Lyme and tick-borne diseases for years or decades, and they're still very ill, what tests, if any, can be performed to determine current status to establish a baseline or prior to beginning a new round of treatment? Are there tests or guidelines established for neurological Lyme?
Well, I would say that there are tests out there as to whether you can now start an actual baseline. I mean, yes, you could start something as you pointed out today. But unfortunately, we know that the tests that we have out there don't detect active infection. And that's part of the that can do that. And of course, there are PCR tests, but again, unfortunately, a lot of times the organism isn't in that material. So there's really not a good answer for that question. I would say that you should examine some of the labs, and I'm sure you probably all know this, but some of the labs that are not like major labs for everything else. You should probably look at the tick-borne disease labs and see what kinds of tests they're offering, because several of them are offering some very specific things now that haven't been offered before. And so I believe, and I can't say because I haven't seen the final on this yet, but I believe that there's a new test being put out there by one of them, and I think we might have information on that soon I believe for Lyme, and I don't know exactly what it's going to be or what it's going to test for or whatever. I've just heard this actually, and so haven't had any chance to investigate it. But I would say your best bet is to do that. And of course, I know that you do have some Lyme literate doctors in your region, and they do a good job. And I know it's difficult for them. And but a lot of them are also part of ILADS, which is really good because they keep up to date on that. And I also know some of you are going, to other areas of the country. I wish I could be more definitive on that. I really can't, because I wish we had those kinds of tests that could really do what that person is looking for.
Okay, thanks. There's another question, if you could help us answer this. What is the best approach to use the antitrust violations investigations from the Connecticut Attorney General?
Well, the Connecticut, that was a long time ago, and use it in the sense, I'm assuming they mean use it in the sense of taking that information and presenting it somewhere. Do you
Correct.
think that's what the individual means?
Yes.
Okay, well, I would say that I use it still all the time, even though it's, goes back to, I think it was 08 or 07. And I would say that you could use it for presenting to doctors if they understand the implications of that, but probably more politically that you could use that by saying that, first of all, the former Attorney General of Connecticut is now Senator Blumenthal, and here's the kinds of things that he found out when he viewed, and looked over the situation with the IDSA, and these are the conclusions he reached, and these are the reasons we feel that there are still problems with the guidelines that are out there, the new guidelines, and we feel that this shows, reveals some of the issues that even occurred way back when with this same organization. I mean, that is really the only way you can use them that I could say. I would say politically is your best bet. Maybe you could, and you would have to really look and examine, what Blumenthal's, there's information, we have information on our website, I think, on it, and he probably, I don't know if he still has it, but I'm sure we still have it. There's information there that maybe, and again, you would have to establish a relationship with someone in your individual states at the government level that might be interested in that kind of material, which would mean putting together a group of people that would go in and sit down and say, to a person who would have an understanding of what that antitrust meant, to say that, you know, you think perhaps that the same situation is in play. And of course, you now have the lawsuit, which is, you know, working its way through. And of course, the insurers have settled, and we don't know what the settlements were, of course, not uncommon though with something like that. And you could bring that lawsuit also into play. And perhaps you could pique the interest of somebody there in government.
Okay, very good. Thank you.
Okay, we have another question. How can we support doctors who are treating Lyme to protect them from medical board reprimands?
Okay. Most people would immediately want to say, which is things we've done in other states, and I've, you know, helped states to write this legislation. But in your states, I do not recommend that you go that route. And here's the reason: that asking for legislation can be very dangerous. And the reason I say that is because once you pass legislation, it is rarely, if ever, repealed. So if you get legislation and that legislation is bad legislation, you're going to be subject to that probably forever and ever. And so the problem when you go to develop this legislation, and again, I've probably helped in I don't know how many states. In fact, I worked in the original Rhode Island, where I practically lived in Rhode Island for several years, running back up and forth from here, which is, you know, not a little trip, but nonetheless, to get that legislation passed there. And we got both the doctor end of it and also the insurance end of it. And of course, we did have help from a lawyer up there that, you know, was working with the governor. So that was certainly helpful. But I have to tell you, it was a big battle. The same thing happened. I worked in Connecticut for that legislation, and people actually thought I lived in the state. I'm not exaggerating, because of how much time I spent there. And the reason I'm telling you is, if you do this, it is a giant commitment. You have to make a big commitment. And the first thing you would have to do is you have to go in and you have to educate your legislators. Never, ever, my opinion from many years working with legislation, never allow someone to just introduce a cold legislation. Because if there's not people in your legislature who are knowledgeable and know enough about your plight and know enough about Lyme and tick-borne diseases, what's going to happen is that legislation will be commandeered. It's happened to us, and we've had to actually end up killing certain pieces of legislation, because with legislation, every word counts. I mean, I'm making this up, but where you put the word "the" in a sentence here or put it in over here, probably not the word "the," but some word, will impact the whole and change the whole shift of legislation. And these people are really good at doing it. And by these people, I mean those who are against chronic Lyme in particular. So to do something like that, you better have a commitment. You better have more than one person who's able, both physically and also knowledge-wise, to be able to be constantly doing this and constantly working back and forth with the legislators. And you have to have a key legislator. You can't do it without a key legislator. However, people sometimes tend to be naive. I've been in politics 42 years, folks. I am not naive. And I will say that what sometimes happens, legislators do certainly have their constituents' interests at heart most of the time. However, they also oftentimes have agendas that they have to satisfy. So you have to be on top of it all the time, and ensure that nobody is taking and revamping that legislation. I had it happen to me on the federal level. I had it happened to me on the state level. And it was only because of my vigilance that I was able to actually get back what we needed in particular pieces of legislation. And so those are just my words of advice. So you might say, well, what can I do? Well, what I believe you can do is you can certainly be putting together materials and things that make the case for other physicians and make the case for your, people in power that you have to have doctors who have the right to do these things, but maybe you can do it a different way. For example, in New Jersey, what we did early on, I went to the medical board and I took, actually at the time, I took Dr. Fallon from New York, and we met with the medical board, and he presented material, I presented material, and I didn't hear anything for a year or 2 years or whatever, and all of a sudden they contacted me. And they kind of worked with us to help to put people in who had a little more understanding about Lyme and tick-borne diseases. And so these are the kinds of things that can be done. Other states have also worked with their medical boards in order to get certain things passed. In Minnesota, that's what happened. And sometimes these things can work, sometimes they don't work. We had it working in New York for a lot of years. I was up there and I worked with the legislators, with a couple of New York people, and we got something passed that lasted for quite a few years that wasn't really technically legislation. It was kind of an agreement kind of a thing. And then eventually that wasn't good enough. And so then legislation had to be done. And then the people in New York a couple of years ago went and got legislation passed based on some of the other state legislation. But they already had a legislature at that time who knew a lot about it and who were experiencing so much disease. You don't have that. You don't have that, folks. And so it's very difficult. But I say to every doctor that you go to, whether it's your Lyme doctor or you go to somebody else, try to educate those medical professionals, because you never know when you might need them in some way, even if they're dealing with some other aspect of your health, excuse me. And so, this is helpful. Educate your dentist. I remember the first time that my dentist, I came in and he was so excited. I didn't know what had happened. This was years ago. And he said to me, "We diagnosed our first Lyme patient." I'm like, what? But basically it was because we had discussed, it's not easy to discuss with your dentist, by the way, as you might know, because you're being worked upon and it's difficult, but you could prepare materials and you can provide them with stories. And don't think your stories aren't important. Your stories are important, but you also have to get those facts behind the things to present to them, and make up little sheets and make up maps that say, yes, we do have Lyme disease here. I mean, our LDA maps do show that you have disease there. So yeah, we do have it. And it's not as reported as it should be, but it's here and you need to know about it and you need to be looking for it. These are the things that I can suggest from, and I know it's difficult because everybody wants to think that legislation cures everything, but unfortunately it doesn't, especially if it gets commandeered. And again, that happens.
Thank you. Leslie, we have one last, well, we've got a couple more questions and then we might need to wrap it up.
Maybe we can work through these last few questions quickly here. One is, can we present to Washington the reports from the SPA in 1993 the EPA found Lyme in 60% of the ticks at the Fort Leonard Wood in Missouri.
What, SPA? Is
It was
that what it said?
corrected down here. Yeah, SPA.
My guess, I don't know what they're talking about SPA, but my guess might be is that all the major military installations have been mapped for these tick-borne diseases. They were all done, amazingly enough, in the 90s. They were done a lot, and which always bothered me because I'm like, well, why are they doing it here? What about the rest of us out here? You're mapping what the risks are, and I'm happy that you are, but why are you doing it when the rest of the country is not seeing it? And yes, I know Fort Leonard Wood, I know other, places across the country, very high incidence. And could so I think the question, I believe, and I don't know, if
Yes,
the
could that
question
be
is,
presented to Washington, D.C.?
yes, you could certainly do that, but and some of the, I believe they might have updated some of the reports, but for whatever reason, it becomes, now you don't get as much information about that. And to be honest, I mean, I've worked now quite a bit with the military, and there hasn't been the focus that there should be. I've presented to them in Washington. Congressman Smith set up a big meeting, and we had military physicians there. But they're getting a little bit better now because they're having to actually get people out of the service because they're Lyme disease and they can't do their jobs. And so now it's becoming important to them, and they're seeing how many, not only military, but how many patients, how many of their dependents are getting Lyme. So yes, that could certainly be used, any kind of material like that. But I would suggest if someone's using it, that they go online with the military and try to find out if there's some updated reports in the, I have the old reports somewhere in my many files, but yes.
Okay, well, thank you. And then I think a lot of us are very curious about this one. Who decides who serves on the working group?
Good question. And it took a while for us to even decide who that was. Basically, the bottom line, after a lot of prying and whatever you might say, wringing of hands and so on and so forth, it appears that the working group is actually, what happens is you put in your application, and it's kind of rigorous. You present all your qualifications, and you send those in, and then those qualifications are reviewed by federal officials that are, I believe, on the working group, and the federals, not the others. And then that also has to go, it's my understanding, I believe that goes through the White House. That has to be approved somewhere. The people have to be approved somewhere at that level. And it also, there are conflicts of interest. Everything has to be declared. And then what happens is, and I believe this is true, I've been led to believe that it is true, that the agency people that sit on the working group select the working group individuals. And I will say that your conflicts of interest have to all be declared, your financials, everything, just letting you know for anyone thinking about it. And of course, this technically will be the last working group, this 2-year one, unless it's renewed by legislation. Whether it will be or won't be, that remains to be seen.
Okay, it's almost 9 o'clock. So our final question is, how can we help? Testifying, advocacy, how can we help?
Okay, well, actually, all of those things, and we do, at least the LDA, and I know LDO in California, we work a lot with them, and other groups, and your Lyme group has been a party to a lot of this. We do ask for, sometimes we'll ask for groups. It all depends on what audience we're appealing to and what information we need and how many people that we think that needs to that need to be represented to accomplish whatever it is. So sometimes we'll ask groups to sign on to things. Other times we ask individuals, or there'll be petitions that are put out there for individuals to sign on. That's how you can do it. Additionally, and I didn't mention this, this is very important, folks, and this you can do at your local level. It's very important that you start, and this is a lot easier, educating your local people. Go to your, I don't know what kind of town hall meetings you have, there, but you need to go and you need to make a pain of yourself about it. By that, I don't mean you go and you scream and shout, but you go periodically, various times when something comes out that you think is significant. Go and stand up if they have, I'm assuming they have a public portion, hopefully. I don't think they've stopped that yet. And say your piece, and that gets entered into the record, whatever record they keep. And then if you meet your council person or whatever they call them out there, I don't remember anymore, but when you, go in the store or wherever you go, you tell them, and you tell them how your family has been affected, what can they do, and ask them. And I don't know, the Congresswoman mentioned the April Lyme Disease Awareness. Most states do May Lyme Disease Awareness Month. Many states will do that, and you can get your local government, you can ask your state legislature, and sometimes they will do that because that's easier for them, but it still gets recognition. So if you can get a Lyme Awareness Month, and what you do once your legislature does that, then you can get that to your newspaper. Then that becomes news, or not newspapers as much anymore, maybe physical, but that too, but also online papers, and get that out there. That's how you build, this. And if people do it in all their different communities, that's how your state legislature will eventually take notice. Also, your county legislature. And the things to me, I out in Kansas, at least when I lived out there, there was a heck of a lot of corn and a lot of other, farming type entities. I mean, things with, what risks those people are at that are involved in that, if they are still indeed involved in that. I don't know how much now is taken over by conglomerates or how much is still personal farmers, or but these kinds of things your legislators and your local and your county people should know. Find out if people that are working in these areas are at a higher risk. Are they constantly getting bitten by ticks? Maybe they didn't get Lyme or ehrlichiosis or tularemia, but maybe they're getting bitten and will soon. So try to find out and present those kinds of things. And again, be nice to these people, but it's their jobs to listen to your concerns. Mm-hmm. And you kind of have to make them listen in a nice sort of way.
Thank you. And I do have one final comment that an attendee mentioned, and she writes, Pat Smith is the Aaron Brockovich of the Lyme world.
Well, I wish I had that power, but I'll do my best to. I'm here, folks, for one reason, and I tell everybody this. I hope you recognize it. You can't have been in this for 37 years and not be here to do the right thing. I just want it to stop. I want our children, our adults, everybody. I want this to stop because, and I just told this to someone significant the other day, I can pull a report out of my files from 1992 at a talk that I gave, and I could give the same talk today and the same issues would be there.
Wow. Thank you.
Judy, I can see you
Yes,
for
you're on
the
video
first
now.
time. You're
I'm
there.
back.
Yes.
Hi. Matt, you are an encourager and a wonderful example for us to hang on to and to persevere. And I just thank you a lot for presenting tonight to the Midwest group. And we'd love to have you back if you will have us again. And I know we have a lot more questions, but probably some of us are, well, we're chronically ill and we need our sleep, right? Or we don't sleep. I don't know.
I understand, believe me.
Yeah. And so this has been great. And you've put so much into this presentation for us, and we just really appreciate you.
Well, I don't want you guys to be left out. Believe me, I don't.
Thank you. And to
Thank
Kyle,
you.
thank you for helping us with this Zoom. And we have things to work on, so it'll be better next time.
Well,
Yeah.
I thank you for the opportunity and thank everybody for their work, and good luck to you all.
Thank you so much. And we'll be in touch.
Take care. Have a good
Thank
night.
you.
Thanks. Good night, everyone.
Good night.